let's start. Good evening, Dr. Vadra.
Good evening,
First of all, could you kindly introduce yourself briefly?
Yeah, my name is Dr. Monotosh Bhadra. I came from India back in 1977, and since then I've been living in UK. Previously, I worked in different hospitals. Then I went into general practice. For last 25 years before my retirement, I've been in general practice in Scunthorpe and Hull. And I retired in June 2014. And I am basically leading a retired life.
Good, very good. So, did you know about what holistic health before we met?
Yes, I knew about holistic health through my general practice.
Good.
And basically it consists of 4 things to have a good health. One of them was physical health, second, mental health, third, spiritual health, and fourth, social health.
Good. Now, before we met, how was your health? Can you just tell us briefly why you came to us, me, and
While I was working in general practice, my health was fairly good. Occasionally, I was getting pain in the tummy, and I went to a surgeon, and through scan, he came to diagnose that it was due to intestinal adhesions. Other than on the emotional side and spiritual side and social side, it was really optimal. I can't grumble about that.
right? So, what happened when you came to me?
After I retired, because of the recommendation of the surgeon, I went for an operation in July 2014, soon after retirement. But it ended up in major complication. I was really poorly following these complications and operations. I lost about 6 kilos in weight. Physically, I was very weak. I was walking with stick. And after that, I went into major mental dips. And I was not in a state to cope with the average necessities of life. And so my life was very much limited in terms of mobility, in terms of interactions with people, and I was not able to take part in any social activity which I used to do before this operation. So there was a period of about 2.5 years. I really could not pull up myself to carry out these activities,
Right.
which was really very painful for me.
Right.
And my family was also very distressed.
Right. Now that we have worked together on a holistic health approach, how are you feeling now? How is your health now? And how are you doing in all these components of health?
From 2015, we were inspired by Dr. Sen to start yoga. Initially, for about 5-6 months, I did not see any palpable benefit, but gradually I was able to carry out bigger tasks, was gradually getting involved with social activity and personal interaction, and things became eventually better. And in terms of physical as well as mental health, it was a major improvement, and subsequently there was improvement in the social well-being and later on spiritual well-being. And I would recommend that to anybody to take up this holistic approach whereby a person can turn around his way of life in all these 4 areas of life.
Right. Okay. Could you kindly tell us, do you still need the stick to walk around or go anywhere?
No.
No. And do you feel
I
more
do
confident
gardening,
now?
I do walking, I do shopping, I do gardening. All these activities I carry out
Could you kindly
without any hitch.
good. Could you kindly tell us you are very, very active now in your community doing cultural activities. Could you slightly elaborate on that, please?
In 2014, 15, 16, I did not do anything in terms of cultural event, programs, musical evenings, or gatherings. But towards the end of 16, someone came round to me and he mentioned, Dr. Badra, you have not done any social event, meaning cultural event, for a long time. And he then said, if you are prepared to do it, I can help you financially. So I took up the task and it became a grand success. And all the people who were in the clubs, they gathered around me to revive the society which I was in. And that society has got many, many members. And since then, we are doing Holi celebration and other celebrations as well.
In what cities you have performed your cultural activities?
In my cultural activity, one of the things that I did was that I was telling people in my society or social cultural group that these are the events we can do, and they all listened to me. And then we are having several meetings in different people's house, and we're doing 2 social evenings, one in April and one in November. This is one part of my activity. Then I developed another interest that I'll set up a group called Digontika. And in this, we didn't have many members, but the members I had were very willing participants, and they all had some degree of talents, and they could perform in many, many areas, including recitation, dancing, singing, and narrating. And following this, we had about 5 invitations from different parts of England, including Liverpool, Bolton, Walsall, and so on.
Thank you. Thank you. Just final question. Now that you know the power of holistic health, would you recommend this holistic health to your loved ones?
Absolutely. I would suggest that anybody, whoever interested in improving on this global aspect of health, should and must take up, whatever the age, so that they can look forward to their existing life, and they will be more focused, and they will feel vibrant in themselves. So it is not an option, but it is a must for people.
Thank you so much. Thank you for your help.
Thank you, Dr. Sen.
Thank you, Dr.
You are
Bhadra.
welcome.
ঠিক আছে, এবার শিপ্রাদি। শিপ্রাদি একদম যোগা ড্রেসেই আছো তুমি। আমাদের ট্র্যাডিশনাল যোগা ড্রেস।
তুমি কি শাড়ি পরে আসতে বলছো?
না 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 না, ঠিক আছে ঠিক আছে, না না ভালো, ঠিক আছে, এটাই ভালো। হ্যাঁ, সেম কোয়েশ্চেন হবে। হ্যাঁ
আচ্ছা
আচ্ছা আচ্ছা, যোগা ছাড়া আমরা আগে যে আরো যেগুলো করছি, যেগুলো ইম্পর্টেন্ট থাকে লোককে বলার জন্য, সেগুলো হচ্ছে কতগুলো হচ্ছে এই যে লাফিং এক্সারসাইজ আমরা করতাম, তাই না? তারপর ধরো মাঝে মাঝে আমরা মেডিটেশন করেছি, এই জিনিসগুলো একটু উল্লেখ করবে, আর কিছু না, বাকি সব ঠিক আছে। হ্যাঁ, তুমিও বলবে তোমার যা হেলথ আগে ছিল, তুমি যেরকম ফিল করতে, এখন যা ফিল করো। হ্যাঁ, আগে যেরকম তুমি পা ভাঁজ করে বসতে পারতে না অনেকক্ষণ, এখন পারো। এই সব জিনিসগুলো তুমি যা ওভারঅল ফিল করবে স্যার, যা সত্যিই সেটাই বল।
না না, এখন আবার ওয়ার্ডস হয়ে গেছে।
না, এটা তুমি হাইলাইট করবে যে এখন লকডাউনের জন্য কিছুদিন আমরা করতে পারছি না, সেই জন্য আবার আমি আই ক্যান ফিল দ্য নিড ফর ডুইং দিস রেগুলারলি। ঠিক আছে তো?
ইয়েস।
ঠিক আছে, দাঁড়াও 1 সেকেন্ড।